Hey, peace, everybody. It's Dr. Sean Tassone, America's holistic gynecologist, coming at you with another fun and entertaining episode of Confessions of a Male Gynecologist. Now, today, I want to confess something to you. We're going to start with a confession today. You are being lied to about hormone testing. You are being given misinformation about hormone testing, and you are simply, in many cases, either not being tested enough or being tested way too much. Now, I want to preface this by saying there are many, many air quotes experts in hormone replacement out there. And I use the air quotes because we all know that you can pretty much say that you're an expert in anything these days, and it doesn't really mean anything. We have seen a death of expertise. So I am here to tell you how to do it. Whether you go to your regular OBGYN, your naturopath, your small town hormone expert, I'm going to tell you what tests to ask for, how to do the testing, how to know when you're being kind of not lied to, because we don't want to say somebody's actually lying about it, but how do you know when you got to see through the bullshit, as it were? So, why get hormone testing? I don't mention other providers on here that I have a beef with, so I'm not going to mention names. But I will tell you there are a lot of providers out there that say hormone imbalance doesn't exist. And not only does it not exist, you don't need to have any testing done. Now, their reasoning for that is that if you're in menopause, we kind of know what your hormones are doing, anyways. They're basically in the basement. But what if you're perimenopausal? And then what if you have a part of your cycle, especially like poly or PMDD, where premenstrual dysphoric disorder, where you have issues in that kind of luteal phase or the second phase of your cycle? Um, I do think testing is amazing. I say test, don't guess. I think that testing, it can open doors for many women. You can look at my reviews on Google and see that there are a lot of women out there that I've helped. And that help comes from testing and from seeing lots and lots of patients and listening to their stories. So, first question I always get is, when do I test? Now, the purists out there, and you can always tell who the purists are because they make you do things a certain way. And in my expertise, in my experience, the purists are the ones that probably have the least amount of hormonal knowledge. They're so limited by the knowledge that they have. They've probably had a weekend course or some sort of course, and it's not their norm. You're talking emergency room docs, plastic surgeons, people that don't usually do hormones on a daily basis, nurse practitioners. So they go to these weekend courses and they are given a protocol, and they're told that you have to test on a certain day of the cycle. Now, puritanical ways of doing things aren't necessarily bad, but they're very limiting. So what they're going to tell you is they want you to draw blood on day 19 or day 21, or they want you to do your testing on day 19 or 21, with day 1 being the first day you start your bleeding. The problem is, for women that have irregular cycles or women that aren't having cycles, that's damn near impossible because you don't know when it's coming, and you may not have a period but every 6 months, if you are even having a period. So, that being said, you find that you can be limited in that. So you go see somebody, you spend gobs of money, and then they tell you, well, we're not going to draw your blood for another 3 weeks. So that can be a problem. I would say you draw blood whenever you have the time to draw the blood. Now, I say that and I use blood, and we'll find out why. Because there's so many things in this world, your schedule, my schedule, your kids, your car breaks down, that are limiting. If I know when you did your testing and where you were in your cycle, because I have that depth of knowledge working with tens of thousands of patients, I can correlate the values to where you were in your cycle. I don't need to have them on day 19 or day 21. Now, that would be great, but I don't need to have that. And also, the other thing about labs is that you don't have to be puritanical in the sense that you only get them on the certain day, you only do a certain type of lab testing. So there's different ways of doing things, and I completely understand that. But let's break down why we test. We test because anytime you see somebody, obviously they're going to take a medical history and they're going to ask you. I always ask, first question when somebody comes to see me, what's bothering you the most? Like, what things are we dealing with? Insomnia, weight loss, hair thinning, decreased libido, decreased energy, issues with your skin, all kinds of things come up. And I want to know what's bothering you the most before I even take a look at the labs, because I think the labs can bias you as a provider and say, oh, the testosterone's low, we must give testosterone. Well, if you have a great sex drive, your energy levels are great, your workouts are great, but your testosterone's a little on the low normal side, we don't have to give you testosterone. You don't need it. So let's look at, we talked about when to test. Basically, I would say anytime, as long as your provider knows when you were and where you were in your cycle, we test. All right. What kind of testing do we do? Well, there's 3 different ways to test hormones. There's blood, urine, and saliva. I'm going to break all 3 of those down, and I talk about these at length. So if you want this, other than the show notes, if you want this kind of spelled out and something you can hold on to and look at, you can go to Amazon and buy my book, The Hormone Balance Bible. It breaks all this down for you, and it breaks down actually all of the hormones, which we'll go into in another episode because it's too much to cover here. Testing. I will start with saliva. Now, salivary testing is a device by where you usually have to pay cash for this. The people that usually do salivary testing tend to be naturopaths or alternative medicine providers, and I'm going to tell you why. Many of them don't have the ability to order blood. They just can't send you to Quest, LabCorp, Clinical Pathology Labs, or one of those mainstream labs because they don't have a license to treat, in the sense that they can't order lab work. And in some states, they can't order prescriptions and things like that. So what they'll do is they'll go to the cash only model where they'll order saliva or urine. Now, saliva in almost all studies will not be 2 things. It's usually not reproducible in the results, and it's usually not something that is very accurate. And I'll tell you why. The way that we secrete hormones into our saliva is very random. And so you might secrete differently than your sister or your mother or the person sitting in the next room. The problem is the lab values don't correspond for that. They don't calculate for that. There's just basically a range, and you either fall in it or you don't. And that's true with all labs. But the problem with saliva is it's very dependent on how you secrete. It's very dependent on the timing. It's very dependent on, had you had anything in your mouth, hot drinks or food. It can throw the values off. So they've done multiple studies on saliva testing, and they'll test blood at the same time. And I've had so many women that come in with high progesterone or high DHEA or whatever, and you do blood at the same time, it doesn't correlate. And we know that blood is actually accurate because it's blood. It's what's in your blood at the time. But there is one saving grace for salivary testing, and that is cortisol. You can actually get pretty good results with cortisol. And actually, serum or blood testing of cortisol is very poor because you can't really have people come in 4 different times a day to get their blood drawn. You can get an AM cortisol, which will give you a starting point, but it's not really the greatest way to do things. So, that being said, saliva testing, for what it's worth, is fairly worthless. Now, I will get some kickback on that. I'm in a lot of Facebook groups for hormone providers, and many, many, many do hormone testing through saliva, and I argue with them ad nauseum. I think eventually they switch over, hopefully, because I do think that by doing salivary testing, you're doing your patient a disservice. So, salivary testing, I wouldn't waste your money. If you're going to go on bioidentical hormones, waste your money or spend your money more appropriately on possible supplements or your prescriptions. Don't waste it on salivary testing. That moves me then into serum. So saliva, no. Serum or blood, what are the pros? What are the cons? Well, the pros with serum testing or blood testing, number one, is that it is usually, if you code it properly, covered by your insurance. If you find somebody that says that it's not covered and that's why they do saliva or urine, my guess is that's a little bit of a fib because I've done this tens of thousands of times and it is covered. Now, it might go towards your deductible, but it is covered. And if somebody tells you it's not, it's probably because they can't order it. So they just tell you it's not covered. Um, Saliva, no. Serum, covered by insurance. What else? Well, it's fairly easy to collect. You drive to the lab. Some offices will actually have the lab in their office, which is awesome if they do. And we can't usually double dip on the lab. So, usually, if we have a lab, we don't get kickbacks from labs. That violates a federal law called Stark, where we're not supposed to self refer. To a lab or something like that and then get kickback. So we could own the lab, but we'd have to disclose that information to you. That being said, serum you can check. Estradiol, if you want, you can check estrone and estriol. Those are the other two hormones for estrogen. I don't usually check those because I don't find them traditionally significant. But you can't really check estrogen metabolites. So the hormone estrone, and we'll talk about this when I go into estrogen. When you look at estrone, it breaks down in the body and it can turn into 4-methoxyestrone, which can have some carcinogenic qualities versus 2-methoxyestrone, which we think might be cancer protective. You can't really check metabolites very well with serum. So that's rate limiting in that sense. You can check progesterone, you can check free and total testosterone. The other way, in my opinion, that you know your hormone provider is not necessarily educated in the realm of hormones is if they only order what's called a total testosterone. The total testosterone is not the active testosterone in your body, it's the free testosterone. So you want to get a test that not only checks total testosterone, but checks free testosterone and a protein called sex hormone binding globulin. Sex hormone binding globulin, as that rises, will actually lower the amount of your free testosterone. So let's say you could potentially have a high testosterone level, but if you're on birth control pills and your sex hormone binding globulin goes up, that's going to drive down your free testosterone. So you could technically have a rather decent total testosterone and a rather puny free testosterone, which means the active form of testosterone in your body is low. So that's why you want to get the free testosterone. So we're going to also get DHEA. We're going to get vitamin D. And in most women, I get two other hormones called follicle stimulating hormone and luteinizing hormone, which are hormones from the pituitary gland that tell your ovaries what to do. And that might at times give me indications on polycystic ovarian syndrome or menopause, ovulation, and things like that. So the main tests are estradiol, progesterone, free and total testosterone with a sex hormone binding globulin, DHEA, vitamin D, FSH, LH. And then also, we don't want to forget about the thyroid gland. So I will order a thyroid stimulating hormone, a free thyroxine, and a free triiodothyronine, free T3, free T3, free T4. Now, again, similar to total and free testosterone, you want your provider to order a free T3, not a total T3, because it's the free T3 that is actually active in your body. That being said, and we'll have an episode coming up on thyroid. The two main hormones with thyroid are T4 and T3. Think of T4 as a storage form of thyroid or money in the bank, and the T3 as you actively spending the money or the active form of thyroid hormone. So, as estrogen levels go up in your body, i.e., birth control pills, you will raise another protein in your body called thyroid binding globulin that inactivates your free T3. So you just don't want to get a total T3, you want to get that free T3. So those are all the hormones, and we'll put this in the show notes so you can take this to your doctor. I have people Women asking me all the time, what hormones should I order? What tests should I tell my doctor I want to get? So those are what you can do. The beautiful thing about serum also or blood is that it's usually covered by insurance. Now you might have $100 or something along those lines depending on your insurance plan, and most insurance covers. However, the labs will tell you what the contracted rates are and then your deductibles and all that, but most of the time it's covered. And I do this thousands and thousands of times a year, and I've never really heard any complaints. The thing that's limiting for blood is that you are limited in the amount of time that the test is valid, meaning it's a Polaroid. For those of you that are old enough to remember Polaroids, it's a snapshot of you while that needle is in your arm. So it's seconds, right? It's only telling me about you that second that the blood was being drawn. It doesn't tell me what was going on later that night or the next day. So that's a limitation. So then we look at urine testing. A lot of people will call this Dutch. Dutch is an actual brand. It's like saying every tissue paper is a Kleenex. Dutch or dried urine testing is actually a brand. There are other brands out there, but for the sake of talking, we'll talk about Dutch. The thing about Dutch that's really nice is that the test itself covers a lot of ground. It checks your estradiol, your estrone, your estriol. So it checks all three estrogen levels. It also checks your metabolites. We talked about 2-methoxyestrone and 4-methoxyestrone. It will check those pathways. So we can see how you actually detoxify estrogen in your body. It will check progesterone. It will check testosterone. It will check DHEA. The beautiful thing is it also does a 4-point evaluation of your cortisol levels that's accurate. It will check melatonin, vitamin B6 and B12, and it will check neurotransmitters products like serotonin, norepinephrine, and dopamine. So we get quite a bit of information from the Dutch. The other beautiful thing about the Dutch is it's a 24-hour spot test. So you buy the kit. The kit comes with these little pieces of filter paper, and it's pretty self explanatory in the kit. It tells you to check a urine specimen the night before, and then in the morning, afternoon, or mid morning and afternoon. There's also an extra one in there if you wake up in the middle of the night. You then dry these little filter papers. You write the date and time on the filter paper. I always recommend you write the date and time on there after you pee, because if you write it before you pee, some people actually pee on the ink and it actually bleeds everywhere and then you can't see anything. So write down the date and time. It's all in there on the kit. And then you mail these little pieces of filter paper back and they will give you your results. Now, this gets me into the limitations of the Dutch in the sense that it takes about 3 weeks to get those results back. And right now, we're running at about 3 to 4 weeks to get results back. So, that in and of itself is rate limiting for a lot of people. So, not only do you have to get the test done, you do it at home. You got to send it in and then you got to wait for your results. So that can be a little rate limiting. The other thing about Dutch, at least for Dutch, it doesn't check thyroid and it doesn't check vitamin D. So if your provider is wanting to check those, you have to do blood anyways. And so that's why I usually start with blood. Another downside to Dutch is that it doesn't get covered by insurance and the prices wildly vary. The Dutch itself costs most providers about $250 to purchase. I don't know the prices if you buy directly from the site. I have seen prices for Dutch anywhere between $350 to $650. Anything over $250 is what the provider is marking up. And I don't have a problem with people marking up the test because we have to go through the storage and purchasing and employees to load them and put the results in the computer. So it all varies. Now, do you need to overcharge it by double? No. But keep that in mind. So you're paying anywhere is probably from $350 to $600 for a Dutch test. I personally believe that Dutch is overused. I think that Dutch should be reserved for difficult cases or those women where after doing a couple of rounds of blood testing, I can't quite get them exactly where I need them to be. If I get women that are doing pretty well with blood testing and they're interested about Dutch, that's great. I also might recommend doing Dutch testing maybe once a year just to get a good baseline. The other thing is if you have a family history of breast cancer or if you have breast cancer yourself, you may be interested in looking at how you detoxify or metabolize your estrogen so that if you are somebody that converts into that bad form ethoxyestrone, we can try to use supplements and other things to help you move that detox pathway into a more protective pathway. So let's recap. Saliva, only good for cortisol. I wouldn't waste your money on it for anything else. It has never been proven to be accurate and it's not very reliable. Blood is the gold standard, at least in the sense that it is covered by most insurance companies and it's fairly accessible. Uh, Actually, the gold standard for hormone testing in the past has been a 24-hour urine, not like Dutch, where you only have 4 points, but where you collect the urine in a bucket for 24 hours and you put it in your refrigerator. It sounds gross, but that used to be the gold standard. Now, serum or blood, covered by insurance, very accurate, pretty easy to do. You get your results in a few days. And base the results. I will look at trends. So if I know that you came in and you had low progesterone one day but you were only on cycle day 7, well, it's kind of supposed to be low at that point in time, so that's okay. But if you come in another time and it's low and it's day 19, well, that's different. And I'll also look at symptoms, so it's not just the blood test or it's not just the symptoms. Urine testing is a little bit different in the sense that it gives us a bigger picture. So it's where blood is more of a Polaroid or a snapshot of you while that needle is in the arm. The Dutch is a span of 24 hours and it gives us a wider picture. And it also gives us other things like cortisol and what's called organic acids like the vitamins and neurotransmitters and things like melatonin and things like that. So it gives us more information. And I do like the Dutch testing. I just feel like it's overutilized. So if you find somebody that only offers Dutch or only offers saliva and doesn't offer blood, it's because they can't order blood. And that to me tells you that they're not probably a licensed practitioner, because licensed practitioners, healthcare providers can actually order blood testing. A lot of these people, and I'll have an episode on credentials and things like that and what they mean. But just because somebody says they're board certified or licensed doesn't actually mean much anymore, because so many of these quasi pseudo scientific societies that have sprung up all over the place give out fake board certifications that don't mean more the price of the paper that they're printed on, but they can still buy a Dutch test and they can learn how to interpret it. So for you, if you really want blood, don't ever be bullied into anything. First of all, if you go in somewhere and you want blood and they don't do blood, find a different provider. If you go to your OBGYN and they won't order your labs because they're being jerks and they don't see the point of it, but you want it, find another doctor that will do it. I'm currently in the process of getting licensed in different states so that I can do this. It was really nice during COVID because we really relaxed the telemedicine laws because people didn't have access to healthcare. Now that we're kind of back out and doing stuff, the laws have kind of tightened back up. But there is the availability to get a telehealth license. So we're working on that here at my office so I can expand and help treat women that are located in different states around the country other than Texas. Now, if you want to come see me or if you live in Texas, the rule currently is you just have to physically see me once a year. And then we can order labs, order prescriptions, and things like that. So, and that just to me is good medicine, a good face to face. How is it any different from being on the phone or a Zoom call? It's not. But medicine will take a while to catch up. I'm pretty sure telehealth will come around. But also, there's a lot of rogue companies out there. You'll see them all the time when you're on Facebook and whatnot, where you can get, for $90 a month, you can get testosterone, you can get all this stuff, and they're not really seeing the patient. So you'll want to be wary of kind of doc in the box places. I would always ask credentials on providers. Where did you get your training? What is your training in? The more initials behind their names, sometimes you want to question that. But really, find somebody that's good and find somebody that listens. So the testing, let's recap that again. If you're getting blood, you're going to want to test for estradiol, progesterone, free and total testosterone with a sex hormone binding globulin, a DHEA, vitamin D, FSH, LH, TSH, free T3, free T4. That's a good start. Now, if you have a family history of Hashimoto's or other thyroid diseases, you could request what's called thyroid peroxidase antibodies to check for Hashimoto's. That's a little bit more involved. You can also check what's called a comprehensive metabolic profile, which checks liver, kidney function, checks gallbladder, and things like that. And you can order a blood count if you're worried about anemia because you're having heavy periods. So that's testing in a nutshell. Review. Saliva, no. Serum, yes. Urine, yes. With the caveat that serum usually is limited in the sense that it can only tell you what your results are while the needle's in your arm. So you might need multiple data points over time. So, like in a year, maybe you'll have blood drawn 2 or 3 times. A Dutch is limited in the sense that it's not covered by insurance. It can be expensive. It doesn't check vitamin D or thyroid levels, and you can take a while to get your results. But other than that, it's a really good test. So, to look at the aspects of testing, it's a very confusing. It's the wild, wild west. There are some standards. Your provider shouldn't make you wait to get your hormones tested. If they're making you wait, it's because they don't know how to interpret them outside of day 21 because they don't have the knowledge to do so. And you'll want to find somebody that actually can do that. I've treated over 40,000 women. I probably do 90% of my testing is blood testing and 10% is Dutch. Now, I will occasionally have a woman that wants to check her cortisol, but that's the only thing she wants to check. So I'll have her order a salivary test off of Amazon. You can buy 24-hour saliva cortisol or adrenal panels for about $75. So not super expensive and can give you the information that you're looking for. I want to thank everybody for tuning in. Remember, Confessions of a Male Gynecologist, we're coming at you every week. Next week, you won't have to listen to me drone on because we're going to have a special guest next week. Keep in mind, this is not medical advice. This is to just give you the information to empower you to make your own medical decisions and to have healthy, happy discussions with your provider. We'll talk later. Bye-bye.